This training video will review how the trigger controls tip shape, release and removal of the handle, lubrication of the introducer, and preloading of the endotracheal tube on the back of the introducer, placement and use of the introducer with any video laryngoscope, and railroading of the tube and removal of the introducer. Hold the device in your right hand and pull the trigger. Note that pulling the trigger moves the tip down. Releasing the trigger allows the tip to return to its upward position. Partially pulling the trigger allows the tip to move into a straight position or any position in between. Note that the tip shape can be controlled as needed during the procedure by pulling or releasing the trigger while navigating in the upper airway. Once the introducer is well placed in the trachea, the handle can be released with the right hand by placing the right thumb on the thumb rest, pushing the thumb rest forward until a click is felt, signaling that the top has been released, then flipping the top to the side. Once the top is open, remove the handle and set it aside. Lubrication and preloading of the endotracheal tube. Each total control introducer comes with SurgiLube, instructions written on the backer card, and a QR code that can be scanned for quick access of training videos. It is important to generously lubricate the introducer before use to ensure smooth navigation of the upper airway and easy railroading of the endotracheal tube over the introducer and into the trachea. The introducer may be lubricated generously with silicone spray or a water-based lubricant such as SurgiLube. Once well lubricated, place the endotracheal tube tip first on the back of the introducer behind the handle. Move the endotracheal tube a couple times back and forth to make sure that the lubricant is evenly spread throughout the tube. Once well lubricated and preloaded with an endotracheal tube, the Runnels Total Control Introducer is ready for use. The video laryngoscope is placed into the mouth until a view of the glottis is obtained. The lubricated and preloaded TCI is then gripped by the handle in the right hand, allowing the index finger to control the trigger. Straighten the tip and place the introducer into the mouth parallel to the blade of the video laryngoscope. Once the tip of the introducer is no longer visible, release the trigger, allowing the introducer tip to come up and into the view of the video laryngoscope. Once the tip is in view, it can be articulated up and down as it is advanced until it is seated at the glottis with the tip between the cords. Once seated at the glottis, the trigger may again be pulled, moving the tip of the introducer downwards as needed to advance over the glottis and into the trachea. Advance the introducer into the trachea until the green zone is adjacent to the glottis. Red zone at the glottis indicates the introducer is approaching or below the carina. Consider pulling back to the green zone. Once well placed in the trachea, anchor the shaft of the introducer at the lip and release the handle by placing the right thumb on the thumb rest, pushing the thumb rest forward. Once a click is felt, signaling release of the top, gently flip the top and remove the handle. Once the handle is removed, the endotracheal tube can be railroaded over the introducer and into the trachea. Once the endotracheal tube is in the trachea, the introducer is removed, leaving the endotracheal tube in place. There are adapters in the middle of the handle. The adapters each have an inset. Note the adapters on the middle of the catheter. Note the insets on the front and back adapter. To reload the introducer into the handle, first push the trigger forward. This raises the front fork. Place the front adapter into the front fork. This will allow the back adapter to seat properly in the stand. Gently flip the top over and then push it backwards, allowing the pins to relock. Note the two pins that are built to seat themselves in the handle, allowing the top to lock in place. Once reloaded, pull the trigger a few times to make sure it is reloaded properly. The device is then ready for use. If you have any further questions, please don't hesitate to contact us at ttcmed.com.